Good morning, everyone. Happy Wednesday. I hope everyone is staying safe and having a great week so far. We're proud at EO2 to be able to offer not only full wound closure, but also amazing pain relief for wounds that have pain associated with them. So we've got a very special live, and I am going to bring on a very special guest who hasn't done a live yet. And it is Dr. Mark Niederauer. Hey, good morning, Dr. Niederauer. How are you?
I'm doing well. How about you?
Very good, thank you. So I was just opening everything up and letting everyone know that we're going to be talking about wound-associated pain and how CDO therapy really has a dramatic effect for patients that have wound-associated pain.
Correct. It's one of the first things we know.
Yeah, absolutely. And so if you haven't followed us, thank you for following us on here. If you haven't followed us on any other social platforms, please make sure that you do. We're on LinkedIn and Facebook, obviously, and Twitter. So give us a like. Let us know where you're coming in from. I know we've got patients and providers all across the world, so you can tap down below. And if you're watching this on replay, still let us know where you're watching us from. We'd love to be able to interact with you. So on all of our different platforms this month, Q and the rest of the social media group, we really thought that we needed to take some time and really talk about pain and wounds. And just as you mentioned, Q, not only do we allow for full wound closure, complete epithelialization, but this pain component as well. So Q, why don't you start us off? Why do you think that there is pain relief when CDO therapy is applied to a painful wound?
That's probably one of the most frequent questions we get. And our current train of thought is that if you think about pain and why pain usually occurs because there's a source, a reason for the pain. In our case, it's hypoxia. So when tissues become starved of oxygen, they begin to send off pain signals. The one we've probably all encountered at some point in our lives is loss of breath. If you hold your breath for too long, go underwater, whatever, get your breath knocked out, you start experiencing pain fairly rapidly. And so that's probably the primary indicator for why you get the pain relief, is that we're relieving, by infusing oxygen into the tissue directly, we're relieving a major source of pain, and the pain goes away. And it sets the wound back on the right healing trajectory, which also has been shown if wounds are healing properly, they're not as painful.
Makes a lot of sense. So what is the fastest? I mean, you've been with EO2 from the start, and so you've heard a bunch of different stories about patients' response to pain and CDO therapy. So what's the fastest pain relief report that you've personally heard?
So our initial reports were, we started hearing about patients that experienced pain the same day of application. So we've been trying to follow it a little closer. It's fairly hard to do, but I think the most poignant one we've heard is from Dr. Charles Anderson. He has a patient that experienced fairly good pain relief fairly quickly early on, but we weren't tracking it closely. But the one experience he did have is where the patient came in and had to do some labs, and they took CDO therapy off for a while, and he went down to do the labs. While he was at the clinic and doing the labs, his pain came back. Fairly dramatically to the levels where he couldn't tolerate it. So he even called up, said, I need to get back up there and get my CDO unit back on. And what was interesting is when he got the unit back on, by the time he got home, his pain had disappeared. Had gone back down to 1. And so that was a matter of a few hours. So yeah, we've seen it within hours in multiple cases now where the pain has been relieved.
I had a chance to actually meet that patient. He was a lot of fun. No, absolutely. That patient, especially in particular, had a very, very dramatic result on that. So it's great. So let's talk a little bit about the research that has been done on oxygen and wound pain. So what percentage of patients report significant or complete pain relief with oxygening?
So it's interesting. Across the board, I don't have a good figure, But we did do a study. We sponsored a study up in Chicago with a nursing group. It was published in Wounds. I'm sorry, in Wound Central back in 2018, and it was Carlson and Bowen and Ingersoll that published it. And what they did was it was a pilot study we designed to look at pain and try to look at the underpinnings of why pain is occurring. Because, for example, when we first started doing clinical studies with Dr. Armstrong and others early on, they all mentioned that they weren't sure how well this would work on wound closure because they'd all had experience with topically applied oxygen and weren't believers.
Right.
Thought we had something for pain relief because they were seeing fairly dramatic pain relief in most of their patients. Well, in this pilot, we allowed the nurses to apply oxygen to wounds that they felt would have the most dramatic effect for pain relief. The only criteria we had really was that the wounds had to be fairly painful. We wanted to target 8 or higher. We had, I think, some as low as 5. But what was interesting in that study is there was 20 patients, 23 wounds, because several patients requested further study on different wounds because of their pain relief. 100% of the patients reported complete pain relief, except for one patient who went down to a 1 from a 9.
Yeah.
Might get to 0.
Right.
But that pain relief in that study.
Excellent. There's always that one patient, right? Always one.
They're always good. And what was interesting, it's common in a lot of therapies, I think, once you see it working and the pain goes away, the patients tend to become a little less compliant sometimes because you don't have that pain modifying their behavior.
Absolutely. Yeah. Yeah. I find even in the last 3 years that I've been with the company, patients' compliance levels are amazing with this therapy because you can see a drastic closure really quite quickly. And then that added benefit of that pain relief is just amazing.
Yeah.
So, and what other evidence is out there, Q, for pain relief associated with CDO therapy?
So there are other studies that have done it. We're starting to track it in most of our studies now, trying to look at pain relief. We have a white paper that's called How CDO Works. It not only shows summaries of some other papers and gives references to where you can find the full paper that have shown pain relief, including some of our own research, but also others, not just our device. And what's also interesting in that paper is it shows, and I think a fairly simple review, how oxygen gets in and the difference in their various oxygen therapies that are available.
Yeah. Yeah, and we will put the link to the clinical research down in the comments. So if you've got any questions about that, you can go on to our website. We've got all of the data there, as well as that really, really well done how CDO, how oxygen works in wound healing. It's an excellent resource to be able to really understand. I mean, oxygen's the most fundamental element in our bodies, right? And so it's important to know how it plays such a huge role in wound healing for sure.
Agree.
Excellent. Is there anything else you wanted to add in on pain?
So I think the main thing to add in is that it is a key, as you mentioned before, it's a key indicator in our patient compliance because it is something that most patients notice fairly rapidly. The pain relief will happen over time in most patients, especially if they're compliant and leave the therapy on all the time, because that way it allows the oxygen to get into the wound, so it allows the wound to breathe like we're breathing now. So it should breathe all the time and have a constant supply of oxygen to be able to heal faster and keep the pain down.
Makes sense. Makes a lot of sense. Q, thank you so much for joining us on the live today. I appreciate it.
Hey, this is very enjoyable. Appreciate it.
Yeah. So if you're interested, if you yourself have a painful wound, maybe you have a patient or a loved one that's experiencing pain associated with wounds, reach out to us. We'd love to be able to have a conversation and see how we can help you. We've got some great data that Q's gone over. We're putting all the information down in the links below, even right now. It's magic and wonderful. So if you have any questions, please do reach out to us and let us know. Our email is info@eo2.com, and the rest of our phone numbers and contact details are on our website. So Q, again, thanks so much for joining us today. And if you have any questions or need more information, feel free to reach out.
Thanks, everybody.
Bye-bye.